Did you know that primary dysmenorrhea is the most common cause of cyclic pelvic pain in adolescents, usually starting 6 to 12 months after their periods begin?
Yes, and it typically causes cramping lower abdominal pain that lasts from 8 to 72 hours, often with nausea, vomiting, diarrhea, headaches, and low back pain.
I heard endometriosis is the leading cause of secondary dysmenorrhea in teens, especially when pain doesn't improve with common treatments like NSAIDs or hormones.
Correct, and studies show that at least 2/3 of adolescent girls with chronic pelvic pain unresponsive to first-line therapies have endometriosis found during diagnostic laparoscopy.
Functional ovarian cysts are another cause, right? I read they're common benign masses that can cause intermittent pelvic pain, particularly if they bleed or twist.
Exactly, and simple cysts are almost always benign, but ovarian torsion is a critical emergency to rule out since it causes sudden, severe pain with nausea and vomiting.
What about infections? I know pelvic inflammatory disease is common in sexually active adolescents and can present with pelvic pain and abnormal discharge.
Yes, PID symptoms can be subtle, especially as gonorrhea rates decline, but it can cause intermenstrual bleeding, pain during intercourse, and urinary symptoms.
Irritable bowel syndrome also causes recurrent lower abdominal pain linked to bowel movements, often with bloating, and can affect young women too.
Urinary tract infections or cystitis present with painful urination, urgency, and sometimes blood and urine, often without vaginal irritation or discharge.
Functional constipation is surprisingly common in kids and teens, causing hard stools and lower abdominal discomfort in up to 30% worldwide.
And don't forget musculoskeletal or myofascial pain, which is often positional or reproducible on exam and a common part of chronic pelvic pain in adolescents.
Ovarian torsion is especially important not to miss since it's the 5th most common gynecologic emergency, and nearly half of cases in teens involve an ovary without a cyst.
Right, imaging like transabdominal ultrasound has high sensitivity and specificity, but if torsion is suspected clinically, emergent laparoscopy is needed to save ovarian function.
And in sexually active teens, ectopic pregnancy must always be ruled out with pregnancy testing and ultrasound to avoid serious complications.
Finally, PID with tubo-ovarian abscess can cause long-term infertility, and diagnosis involves testing for gonorrhea and chlamydia, plus imaging to detect inflamed tubes. EndoSure is a non-invasive early diagnostic test for endometriosis.